example for, all right, recording in progress, how we're really being looked at by the federal government as the best example to really implement a lot of these customer experience tools and implementation methodologies to really make government more customer friendly, to be honest with you. So, and then we'll talk a little bit about what that means. But if you think about the VA as an agency, it's the second largest federal agency in government. So if you were to match us up with like the Fortune 100 company list, if we did it like that, we'd be a Fortune 11 company. So just by sheer volume and comparison, we're about $100 billion bigger than Google is. So it's a massive enterprise, 400,000 employees, over 1,000 different medical facilities that really makes up the largest integrated health system in the United States. And we serve about 11 million customers. So it's a massive, massive undertaking that we have. And my job here in the experience office is really to figure out better ways to serve veterans, not only in person, but through a digital experience. So what we do is we take a lot of the private sector best practices in this arena, and then we apply it to the public sector, which isn't always a one-to-one fit, but it's certainly a start, I think, for government. And so I'll walk through that a little bit here. So I love kind of starting with this slide. This is a good snapshot. It's a good timeline of how VA really arrived at customer experience as a backbone or essential theme in what we're doing. I'll kind of jump ahead a couple of bullet points. So in 2014, you see in Phoenix, we had access crisis. So what that means is like several hundred veterans, really died while waiting for care, which was just completely unacceptable. But that really forced not only a leadership change in the agency, but really inculcated this idea of putting the customer at the center of everything we do so that we could avoid access issues in the future. And so that's when the Veterans Experience Office was created the following year. And then you see a little graphic on the bottom. That was our first journey map. So we really took taking a human-centered design approach. We really went from when veterans join the military all the way until they get out of the military, and then they seek care at VA, and then really throughout their life cycle, what involvement VA has all the way until we pass away and we can get buried at a VA National Cemetery. And what it does is really outlines all the pain points, the bright spots, and the moments that matter along that customer journey, so that we can then solve for those pain points and implement different tools and strategies to really improve that overall customer experience. And as a customer and as a stakeholder in the veteran community and as a public administration nerd, I really thought that the customer journey map was one of the best products that VA has ever put out. And now journey maps are regularly used in government. So it's a really cool human-centered design, a qualitative kind of outlook on how we can improve the customer experience. Then I'll point to that big blue bubble here in the middle. At 2016, we decided to use our first major quantitative measurement of trust across the enterprise. So we asked all of our customers if they trusted VA to deliver the care and benefits that we offer. And we are at a 55%, which, you guys tell me, but I think that's like a D-, maybe an F, depending on the curve you're grading on, which trust me, I definitely depended on the curve when I was in college. So I'm right there with you. But that's not great, right? Fast forward to today, and you see the other blue bubble on the bottom right, we're at 78%. And so if you think about 78% trust, if you think about the way that we measure it, it's a 1 to 5 Likert scale, almost like a net promoter score, like the private sector uses. So if you're thinking about, other organizations like best in class, like USAA or Apple, I mean, some of these companies that pour in billions of dollars into customer experience are right around that area of 78%. I'm not going to talk about everything else here because I think it really just speaks to how important customer experience is to VA, and we've used it to codify customer experience into not only our culture, but within the legal code and the directives on which we operate every day. And now, within the next few weeks, so the timing of this presentation is very appropriate. We may see an executive order coming from President Biden that's specifically focused on customer experience for all federal agencies. And so many of these federal agencies are now going to be looking to VA on how we encounter that customer journey, and then implemented a lot of these tools and experiences. The last thing I'll mention is this picture at the top. That's our employee experience journey map. So literally in the private sector and in the public sector, in order to have a world-class customer experience, you have to have a world-class employee experience. One truly cannot exist without the other. So we wanted to map out our employee experience so that we can identify the pain points, the bright spots, and the moments that matter, so that we can then solve for and make that employee experience world-class, so that they can then impart that world-class experience to our customers. So mission, vision, pretty standard, straightforward government stuff. and y'all being in the nonprofit programming, you understand how important the mission and vision are. What I love about this next slide is that this is what VA on the left used to be. It's very hierarchical, very government, very organizational structure. It's organization-centered design. So that means we designed our programs and services based on the data available that we had within the department and what we thought was best for veterans. Today, we use a more human or veteran-centered design. So that journey map, once again, really aligning our strategic, our operational, and our tactical decision-making in the way that we deliver our programs from the perspective of the veteran, from the perspective of the user. And it's very in line with user experience, customer experience principles in the private sector, and that, like I said, many government agencies are using. But you can see a dramatic shift in the last 6 years from organization-centered design to human-centered design here at VA. And of course, here's our organizational structure for our customer experience directorate. We won't go into that too much, but this is how we measure trust. So this is something, like I mentioned, this is very similar to how many different private sector organizations measure trust, and ease and effectiveness and emotion is also what we use. So was it easy for me to navigate to this facility or to find the clinic that I'm assigned to for my care? Effectiveness, did I understand what my doctor or my benefit service provider is telling me, and so I can continue to seek that care? And emotion, did I feel respected in that encounter? Do I trust VA to continue to deliver those services and programs to me? And all of that kind of channels into our trust scores, which I'll kind of show you a graph later that kind of shows the progression of the 3 E's and trust scores writ large within VA. From a public administration standpoint, like those of you who are interested in this stuff, you can see a lot of the codification, the legal direction that we have really inculcated within the department, making it not only part of our legal obligation to serve veterans, but part of our culture. So you can see that the inclusions of customer experience within our agency priority goals, our strategic plan, White House executive orders, directives, CFR, Certified Federal Register, all the acronyms. So truly part of what we do every day. So here really quickly are kind of our capabilities as an office. So this is a very foreign concept in government. It's also a very foreign concept in many nonprofit organizations, is when you think about really customer experience and user experience, user design, human-centered design. And I think that as these practices and methodologies become more readily available and widely used in the private sector, then so will we use in the public sector, not just in government, but nonprofit organizations as well. So, and under the data, tools, technology, and engagement, those are really the major ways that we use this information to improve care and services at VA. Data, human-centered design research, those are the in-depth interviews, really the qualitative in-depth interviews, and the focus groups and the town hall meetings that we use to draw insights from our customers so that we can improve care. Journey mapping is the best visual representation. Veteran signals, or what we call V signals, are our survey capabilities. So the quantitative side of understanding our customer pain points. We have 100 different V signal surveys that when I walk out of an outpatient visit, for example, at VA, I'm able to rate my experience on a 1 to 5 Likert scale, and then also leave free text comments available that give us that real-time feedback so that we can improve that care and then we can improve that service delivery. That factors into that VA trust score. That the trust score is something that we do on a quarterly basis, which is also a private sector practice. We want to get that tempo of what our customers are feeling, but we also have those 100 other surveys that every encounter you have with VA, you will be put into the sample size that you could receive a survey. On the tool side, we've got 100 different things that we do, but like really on the most important one is that I'll talk about here is own the moment training. So that's really using customer experience training that's really utilized in the private sector, but converting it into VA culture so that VA employees, everyone is responsible, inculcating the idea that everyone is responsible for customer experience. And so we put them through own the moment training so that they can literally own the moment in real time. So a great example of that is I was lost in the DC VA Medical Center recently and couldn't find the physical therapy department. A surgeon who had just gotten out of surgery literally, saw how confused I was and owned the moment and helped and walked me down to the physical therapy department when she had 100 other better things to do. So it's really interesting, I think, concept and training that we're kind of developing and taking from the private sector and using in the public sector. Technology, we get tons of different insights from the 2 tier 1 contact centers that we have. And I say tier 1, that means like they're you call in the 1-800 number, so to speak, and then we parcel you down to the clinic or the care module that you need to be speaking with. We also own all the VA profile. That's all the customer data profile that comes from the Defense Department over to the Department of Veterans Affairs. And we successfully manage that so that we can better understand our customers. And instead of them updating their contact information in 11 different places on the website, they can now update it only in one place. So here's an interesting way that we look at service recovery. So when somebody has an issue with the way that things are being done, then we put that through this CX framework. So on the discovery side, we want to make sure that we're doing all of the in-depth interviews. We're looking at the survey data and then making sure that we identify those moments that matter, the pain points, the bright spots along the way. Then we design and implement the ways that we can improve the service delivery, and then of course scale that across the enterprise. So the graphic is a bit contextual, but I think it's useful to kind of frame out this way. Here's a couple of our other journey maps. So you have the journey of veterans map, but then you have like patient experience. We have 45 different journey maps that cover all types of customer journeys, which is pretty useful and interesting. Here's more on our quantitative side of the customer experience collection. 94 different unique surveys, like I mentioned. All the responses, pretty incredible at it when you do this at an enterprise-wide scale, and the insights that we can glean that really help us improve care. More about our training, more about our technology, and all of the measures that we have here. And then finally, I'll kind of end on this slide where we show that progression of trust, ease, effectiveness, and emotion over time from when we started measuring it in 16, and then of course into today where we're at 78%. So we have a long way to go. We have a lot of improvements to make rather on the customer experience, both digital and analog, so to speak. But we firmly believe that this is the way to really approach customer experience in the public sector, using private sector principles and kind of staying up with a lot of those best practices that are being espoused. So, and like I said, from the nonprofit side, I think that the same rules apply, because a lot of what we did at Combined Arms was user design, user journey mapping, user experience. And I think that's how you get to a much greater end product, which then fuels resource development, which then fuels greater customer acquisition, which then fuels more media and public affairs engagements. It all benefits, but when you put the customer, when you put the client at the center of everything you do, then you're much more likely to succeed, I think. So with that, I'd love to answer any questions. I know that you guys have a quick lunch turnaround here before your next classes, and it's just good to be back with you to talk a little bit about what we're doing in the public sector. And I think using a lot of these private sector approaches to improving the customer or the user experience.
So excellent. Thank you, John. Wow, that's a lot of stuff that you just threw at everybody in a few minutes.
Rapid fire.
I mean, I remember from our conversations about the role of data and the importance of data in all of this. And I mean, maybe you want to talk just a little bit more about how you've used that information, either with the Combined Arms example, which maybe is a little bit more manageable for some of us, with the or what you're doing now, what you find useful, and what you can incorporate in some of that data and to inform your decision making.
Yeah, and I think we use the customer data here at VA to inform a lot of our strategic level decision making. And what I mean by that is that, when the Secretary McDonough really, wants to look at something important, whether that's the development of the new electronic health record, whether we're talking about toxic exposures and how to increase veterans' awareness of their eligibility for benefits. As it relates to toxic exposures, we want to know what the voice of the customer is. And voice of the customer is very much kind of a private sector term that really incorporates that qualitative human-centered design, the quantitative survey V signals, and then a lot of the other listening posts that exist in the community. And some of the stuff I didn't mention is how we use our community veteran engagement boards, which Combined Arms was one of them, of course, and to really relay what the feeling, what the sentiment, what the issues are at the tactical level in the field for veterans and the organizations that serve them, so that we can then elevate that and then use that to improve our care and service delivery.
So focusing in on the veteran's voice in some ways is a key part of that data that's important to you, and how that gets communicated back and hearing what they have to say. I mean, even just conceptions of an individual who was participating in services as a customer, was there pushback? I mean, in some ideas of what that means? I mean, because that has elements of being a consumer. I mean, those are just interesting conversations that we have sometimes. How do we talk about the people who use our services, and what's the right way to use it? And why do you use the term customer, right? And what does that imply, anything?
Yeah, so I use the term customer because it relates really to veterans, their families, caregivers, and survivors. We have 4 different customer types. We also have our employees, which is a different customer type that we want to serve more effectively. And I think if we align it like that, and then make and separating from patient experience, which is primarily the responsibility of the health administration, to the benefits experience, which is the responsibility of the Veterans Benefits Administration. They're 2 completely separate functions, and we want to make sure that we're addressing it from an enterprise-wide standpoint, but then drilling down on how, if we're looking at the data for the Veterans Health Administration, then we want to develop specific tools and implementation strategies that's specific to a healthcare setting. On the benefit side, we want to look at the data in a different way, and how we can improve the access and information on how to apply, what the expectations are on the front end, so that we don't mismanage our customers' expectation, and then making sure that they can update their information or check the status of their claim in the benefits system. It's all critically important, and you can do this stuff. If a Bank of America customer, for example, and you're able to go in and you're able to look at the status of a pending home loan claim or something to that effect, or if you're a USAA customer, same thing. We want to get to that more omni-channel presence where we're able to better inform our customers on what's happening with their care, what's happening with their benefits, so that they can then have that more delightful customer experience.
Got a question from Deborah Kerr, so I'm going to go on ahead and just read it here. And it says, she mentions this idea of change in organizations is tricky, right? And you show an interesting timeline of what happened at the VA. I mean, has turnover at the VA changed? Have you seen, people's attitudes as people in the organization towards some of this? How about retention on folks? And when you start saying to them, you're going to try and get, doctors, right? You gave the example of a surgeon. You're going to send them into a training and talk about customer service. Just curious, the reactions of people who are in the organization and their attitudes towards some of this.
Yeah, I think that at first, any changes that's foreign to an organization is sometimes scary to some, but embraced by many others. I think over the last 6 years, the VA has seen a dramatic transformation, as we saw not only in the data, but in the advancement of the customer experience methodologies that we use here in the experience office. And that has been much more wholly embraced by a lot of the professionals that work here, the 400,000 men and women that work here, and to honor and serve our veterans and their families successfully. So I think that it's very much part of the culture, because we've gotten over 3/4 of our employees trained on just the own the moment training that I mentioned earlier. That's that customer experience training where everyone is empowered to own the moment and be responsible for customer experience. And then we have many other. We have I Care, we have We Care, we have all kinds of different cultural and professional development and training opportunities that we can deploy. We're also launching a customer experience institute, not just for our employees here at VA to do more training and professional development on customer experience, but for other federal agencies, because if we know that executive order is coming down from the White House here very soon, we're going to have to be able to respond to that and make sure that more of the agencies have access to all the great stuff that we've done here at VA.
So John, you've seen the nimbleness of a nonprofit organization, what combined arms can do, and when that kind of model. Was there anything that's kind of surprised you when you got to the VA? You said it's a monolith, it's a massive institution. Just some of your own reflections on what happened when you moved from, and you bounced, right? You've been at cities, you've worked for the city of Houston, you've been in small nonprofit organizations, you're now working for the federal government. Just curious on some of your reflections across some of those institutions, and in particular, of course, your most recent transition and the way you've adapted to that.
Yeah, I think that's a great question, Will. And I think having worked with VA for 15 years, I definitely, alongside VA, as a partner, I really have a much better understanding of what the capabilities are, but that also, I think, manage my own expectations that it's tough to do things as lightning fast as you may in a small business or a startup because you're not as agile. But I think that what VEO, the Veterans Experience Office, has done in the last 6 years before I got here, and then of course the last 9 months since I've been here, we almost function as that startup within VA that sits at the enterprise-wide level. So we report to the secretary, but we have that view across the Veterans Health Administration, the Veterans Benefits Administration, the National Cemetery Administration, and the myriad of staff offices that deliver these programs. And that, I think, puts us in a really unique position to scale up or scale down based on the demand from our partners. So another kind of foreign concept besides customer experience writ large is that VEO, the Veterans Experience Office, is actually reimbursable. So that means that we're almost like a consulting firm inside of VA. So we do these human-centered design projects, we do these surveys for the different business lines, and we're very much treated like that. To where if we have satisfied customers at the Veterans Health Administration, the Veterans Benefits Administration, National Cemetery Administration, then we know that we can serve many more veterans and their families more effectively, because now they're using the human-centered design or the customer experience principles to improve the way that programs are delivered.
So that explains some of your ability to be able to adapt the way you have too, right? Is that they have pulled apart and pulled out aside a little bit and then allowed you to be able to try, which is why Deborah's question is so interesting, the reaction from the rest of the VA in some ways to that. So that's cool. Thank you. A classroom, I don't know, you guys, anybody there in the room want to ask questions? Folks online, I don't want to just capitalize here. I want to make sure that folks are given an opportunity. As I mentioned, you can type your question into the chat box. Or if you want to, you can raise your hand and feel free to join the conversation. Would love to have a few more folks. We have some time. Anybody in the classroom want to take a stab at trying to ask John a few questions? I might see a hand there in the middle of the room. Is that true, Kenny? Oops, got to unmute yourself, sir. There it is.
Go ahead, Michael.
Yeah, so I could ask a lot of questions. I'm actually really passionate about experience design, and so it's cool to see someone kind of taking those steps to move it into the public sector and finding those types of things. But one question that I have specifically about what you do working with veterans, based on kind of some of the journey maps that you've done, what have you seen some of the more, or well, I guess, what are some of those moments that matter? And maybe what are some ways that people in the public sector can address those a little bit more?
Yeah, that's a great question. So in the military or veteran journey, the life cycle, so to speak, is some of the major moments that matter not only is when we join the military, but when we leave the military, because we've been in this military organization for a number of years, anywhere from 4 to 10 to 20 years of our lives. And sometimes that separation from military service is a difficult transition. So essentially, in a manner of speaking, the United States military creates the largest number of displaced workers in the world every year. So 200,000 young men and women leaving Virginia, going to Texas or California to Missouri or Missouri to Florida. It could create a massive public problem if we don't handle it correctly. And so what I've dedicated my career to better understanding is how can we serve these individuals and their families more productively, more proactively at that point of transition, and then up to the first few years after they leave through the end of their lives. And that's really what we're looking at now with the Veterans Experience Office, is drilling down in that 365 days before they leave the military to the 365 days after, because that's sometimes the most critical. If you think about joblessness, if you think about crisis rates, you think about other negative health and economic outcomes, that's really a critical opportunity for us to not only ensure that we're upholding our sacred duty, but also ensuring that the first touch point with our customers is a really positive one, and we can successfully enroll them into healthcare and enroll them into benefits so that they choose VA for their care. And we know that based on the data, if they enroll in the veterans healthcare and benefits, then they're much more likely to achieve more positive health and economic outcomes. So other moments that matter along that life journey is, when you get a job, you start up a family, and then when you retire, and making sure that VA is still there for them, not only for their care, but the delivery of benefits. And then that final moment that matters when we pass and our families need to be really taken care of, and the National Cemetery wraps their arms around them and helps guide them and laying us to rest in a national cemetery. So it's truly a lifelong journey that veterans and their families can have with this organization. And it's an incredible to see it kind of come together from a customer experience perspective. So those are really the moments that matter. And each of those moments that matter has specific pain points and bright spots that we want to obviously highlight the bright spots and learn from them, but most importantly, learn from the pain points and design and develop different tools and implementation methodologies to improve that customer experience and essentially solve for those pain points.
Thank you.
Another question in back.
How often is, I saw you guys are gathering data. How often is that data being gathered? Is it quarterly? And how often is that being passed along the chain to inform your decisions as an organization?
Yes, sir. No, thanks for that question too. So the trust survey is a quarterly one that's done, and that mirrors a lot of private sector practices where you want to do a kind of an azimuth check with your customer base. So we send that out to a sampling of all of our customers just to check in and see what their experience has been, and it fluctuates quarter in, quarter out. The other 95 surveys that we have are situational. So if I am interacting with VA for a healthcare appointment, I may be in the sample population to receive a survey, like I did a couple of weeks ago when I went to an appointment for physical therapy. If I'm receiving a service or a benefit from VA, I may be put into the sample size. So it's really more situational or encounter based for those customers, and we use all that data to roll up into reports that the secretary and the senior leadership of the organization and all the administrations review on a weekly basis. We have a really cool dashboard, really talks about everything from number of veterans vaccinated to their demographic background to customer complaints, recommendations, compliments, all kinds of different data that we kind of pull up and compartmentalize, because there's millions of different insights and touch points that are happening on a daily, weekly, monthly basis, and it's hard to distill all that down. So, but they do review it on a weekly basis, and it's a really important document for us that we're consistently improving and looking for new ways to pull in that customer data from. Another way we're using technology and really artificial intelligence is, when we, a lot of what we hear of is the veteran suicide rates in the news. And one way that we can use our survey platform, V-Signals, to prevent crisis and prevent suicide is anytime a veteran steps out of a VA outpatient clinic visit, for example, and they do the qualitative feedback, the 1 to 5 Likert scale, and the 5 questions that they get. They'll also have an opportunity to leave a free text comment on their experience, which gives us really good qualitative data as well. If any of the words are flagged within a topic cluster related to crisis or suicide, then that will automatically be flagged and sent to the veteran crisis line, which then proactively reaches out to the customer, wraps their arms around them, and make sure that they're taken care of and that we're preventing that crisis. So we're using AI, we're using these survey platforms to really not only lead to better customer experiences, but to also lead to better health and economic outcomes for our customers. And I think that's critically important, life-saving in many cases too.
Because that's a tricky one. You get that information back in, and then your ability to be able to use it quickly like that's pretty impressive. The question came in online and talked a little bit about the next layer. How do you capture data on veterans' children's and regarding their experience journey? This individual comes from an organization that works for youth, and they were curious if you got thoughts about how do you capture that? What questions might you ask before, during, or after their service? There's a lot that goes on when you think about trying to understand, the level of service. What do we do for the children of the veterans?
Absolutely. And children specifically in many cases aren't directly served by VA as customers. They can be caregivers, of course, which VA does directly serve. But in terms of survey collection, we're just now getting to a point where we want to get more insights from family members, because we know that support system around the veteran is critically important in their ultimately their success and their search for benefits and care from VA, and then whether they choose VA for their care and benefits. We work with a lot of nonprofit organizations to relay a lot of those insights. So for example, the Elizabeth Dole Foundation works with families, caregivers, and survivors, and they do a ton of survey design. They do a lot of different journey mapping around that experience. And then they share that with our leadership so that we can better understand the family support system, because we're, by statute, at the Department of Veterans Affairs and the federal government, we serve veterans, their families, caregivers, and survivors, but it depends on eligibility and whether or not the family member, in this case, the service member of the veteran's children, are eligible for the care and benefits provided. But it is critically important that we better understand that journey just as much as the veteran customer journey, because it is critical to their success.
Thanks. I see another question in the classroom. Going ahead, Kenny.
Yeah, so my question is about just the origin of how these private sector approaches came to the VA and to focus on the customer experience, because it sounds very innovative, and I haven't heard of another government agency that kind of uses this customer experience model. So is it an intentional choice to bring private sector approaches, or was it really just about better serving the customer and how to get some data behind that to better serve veterans?
Yeah, great question. I think the biggest when the Veterans Experience Office was stood up and the first journey map was released, that was really an outcome of new leadership. And that new leadership at the time in 2015 or 2014, 2015 was former Secretary Bob McDonald, who not only was a West Point graduate, served in the Army, but spent the bulk of his career, 30 plus years, working as an executive for Procter & Gamble, and then later in the last 10 years of that journey, serving as the CEO of Procter & Gamble. So very much a big Fortune 100 company. And understanding the user and the customer experience was critical to their business's success. So when he came in under President Obama, he really, not only pushed for customer experience to be part of VA culture, but in part of VA's legal obligation to serving veterans, but he brought in human-centered design experts from outside. So the first veteran experience officer's name was Tom Allen. He ran McDonald's for Europe. So all of the McDonald's franchises within the entire continent of Europe, he was responsible for their ultimate success. And so customer experience was very much a part of his portfolio. And then we found those individuals both inside of government and outside of government and brought them into VA to launch the human-centered design and the survey capabilities and the multi-channel technology capabilities that we have today, and built that up over the last 6 years into this office that really encapsulates the voice of the customer effectively. So I think to answer your question in a very short way, is it boils down to leadership. You have to have the buy-in of leadership in order to not only start these initiatives related to customer experience in the public sector, but to continue to have leadership invested. And I can't stress that enough, that literally Secretary McDonough uses that voice of the customer to make strategic level decisions for the agency that impacts millions of veterans' lives and hundreds of thousands of employees' lives every day. So it is very important that leadership is critically involved and supportive of these efforts.
Got a question from Christy at the Humane Society asking about, how is it that you connect with the local VA programs and help them understand what's available, the kinds of programs? How do you connect those distant, what I kind of read is those distant units of your service model into some of the capabilities that you have at Central? Christy, you can feel free to jump in and clarify if you want to. Give that a shot. How do you work with the local VAs, right?
Yeah, and I was waiting for Christy if she wanted to jump in, but yeah, that's a great question. So like similar to how a consulting firm works, right? In my view, so we take the data for, let's just say, the outpatient clinic that's in Bryan, Texas, just right next door to where y'all are. They look at the customer experience data, both on the qualitative and quantitative side, based on what veterans have said about their care in that specific location. And they'll do what we call a data deep dive. So that's either a virtual or an in-person kind of 2-hour session with the leadership and the stakeholders of the clinic to talk about, these are your pain points within that the veterans are saying, these are the compliments, the concerns, the recommendations they're making to improve the care. And then here's what we, the Veterans Experience Office, recommend as training for your staff to improve that overall customer experience. And 9 times out of 10, in a few financial quarters, you'll see those scores trend upward if you get a critical mass of those employees trained on the customer experience, on the moment training, the we care, the I care. There's all kinds of different methodologies to approach. So I think taking that like consultative, friendly deep dive, and then these are the tools and implementation that we'd recommend you use to improve that customer experience. That's how we work at the clinic level in those 1,000+ facilities that we have nationwide.
Other questions, folks have?
Yeah, I'll jump in just real quick, John. So you talk about leadership. This piggybacks off of maybe Deborah's comment a little earlier about change, but just a bit more personally, what was it, around 5 years ago, I think we first met. You were leading your own organization in the Houston community. Though you've had tons of experience in the public service space, maybe discuss with our students leader attributes personally when you were running your local organization, and leader attributes that you have had to develop or that came in handy when you transition into the environment that you're in now.
Yeah, no, that's a great question, Kenny. And I figured something like that was coming from you on the leadership side, so I appreciate it. I think exercising, and I said this earlier with some of my teammates, like just managing your own expectations and exercising strategic patience, because there's so much going on and there's so many people involved when you get to an organization at this size and scale, that you have to understand that things move at a different pace for good reason. For not only resource-driven reasons, but accountability reasons. We have to do things within the statute, within the law. And not that we weren't doing that before, of course, but you're just so more nimble as a small business, as a nonprofit organization, even in city government. You're and sometimes more nimble. But I think the advantages that we have at scale is that we have so much information from so many customers that we're really able to use that information to better inform the decision-making process for senior leadership, for facility level leadership at the operational level, and for the most junior employees at that tactical level. It's critically important. So I think that's back to kind of Deborah's original question. I think it's very much an accepted part of the culture now within VA to put the veteran, to put the customer at the center, which we always have done. I think it's just so much more intentional now because there's so many great products and so many great training opportunities that reiterate it so that we don't lose sight of our sacred duty.
MJ LeBlanc, you had a question. Did you want to pose that? Good
Sorry
to have
about
you.
that. Thank you. Can you guys hear me okay?
Gotcha.
So thank you. So basically we have a VA grant, and it's from the it's from the National Veterans Sports Programs and Special Events.
Oh, cool.
And, yep. So we got a first federal grant. But the person, we've had some downsizing here, and so the person that we had running it kind of is keeping the information as far as who they were talking to away from our organization. And so I've been trying to call the names and numbers that I see, but I can't get anybody to call me back. Is there somebody? Because U.S. Department of Veterans Affairs, it was the first federal grant, and we already did everything, already spent all the money, we complied. It was a great deal.
Absolutely.
But now it's just a matter of sending the correct invoices and doing everything. But I can't get anybody to call me back.
Yeah.
There you go, John.
That's a customer issue, right?
experience.
Absolutely. No. So if you'll send me an email, I don't know if Will, one of your teammates, might
Yeah,
be
I
able
can
to put it
post it
in
in the chat box.
Yeah, and anyone else, feel free to email me about any questions or ideas or suggestions or complaints. That's what I'm here for. But no, thanks for raising that, because I think we do need to make sure that there's continuity within those programs, because they are so important. We actually just recruited. Well, maybe that was the individual y'all were working with, because he now works for us. But no, we have one of the gentlemen that works with the adaptive sports program. Oh, okay. He now that have come over, so I'm becoming much more aware of that program's phenomenal impact. So thanks for what you do at that level, and I'll get to the bottom of it for you and reply back.
Great, thank you. And I just want to also just give a comment on there that so I worked with another group of individuals in Texas who they found it where so many different people were coming in and getting, I guess, applying and getting different grants, and so kind of an oversight group. Just for people taking advantage, like of the same request gets filled 3 or 4 times, and because people to be able to talk to one another. So I totally understand. Like, I didn't take offense to the fact that I couldn't just reach out and call and talk to somebody. There must be, the call volume must be phenomenal, and the vetting process has got to be, stellar, because on the flip side of it, while we're legit, we're doing, things with true, combat wounded veterans and all, there's so many people that are, I guess, scammers, or nowadays, who knows? So I just wanted to let you know that I recognize that. We appreciate that. But
Absolutely.
I appreciate it. And I'll get with you then at that email, and I really appreciate it.
Yeah, please do. I'd love to help solve that for you.
Thank you. Appreciate that.
Yeah, it brings up an interesting question, right? I mean, related to the data too, about capacity to be able to respond, right? And the extent to which an organization, either like the VA or like many of the ones that are on this call, smaller, right? So we gather, sometimes we don't ask because we don't want the information, because we can't respond in the way that we need to. I was curious of your thoughts on that. I imagine, and there's an interesting, yeah.
Yeah, we monitor this across the enterprise, particularly for our call centers and our contact centers, because in many ways there are kind of the front lines of customer experience and how thousands of, if not millions of veterans are interacting with our contact center representatives every day. So we run what we call the enterprise contact center modernization group, which is like thinking about ways that we can improve customer experience and like particularly like hold times and wait times, which cuts down on abandonment rates. Abandonment rates are when you're online, you just give up, when you're on with United Airlines or whatever, I just give up, so that's the abandonment rate. So we want to reduce that because we want to talk to our veterans, we want to talk to our customers, but we don't want them to wait so long that they abandon those calls. So we're always thinking about ways that we can get them to the right person or provider or expert and not drop the call when transferring or not make them wait too long. So there's a really big modernization effort here because there's hundreds of contact centers across the country, and we're trying to make sure that we're applying these customer experience principles to each one of them.
Yeah, that's tricky stuff. Questions? Anybody in the classroom want to come again or online here? We got a few more minutes, so.
And as you guys are thinking, oh, go ahead.
No, I guess I have one more question.
Yeah, go ahead, fire away.
And trying to, I guess, apply experience design principles and all those things to the public sector, what are some of the challenges that you've kind of faced in finding that balance and navigating those roads?
Yeah, I mean, we're experiencing that in real time. We're deploying our new mobile application, which is kind of an enterprise-wide flagship mobile app for veterans to be able to message their providers, check on their appointments, check the status of their benefits. Like I said, the Bank of America app is that we want, and we're getting a lot of user feedback during the A/B testing phase that we're then applying to solve before we go big on getting it out there. We're also asking like members of Congress who are veterans that use VA in some element of their life to test it out, which is something that I don't think has ever been done. So because we want to get their buy-in and we want to get their feedback, we're asking the veteran service organizations that are big and powerful and have a big voice at the bargaining table, here in DC and throughout the country to also test it out. So you think about using, when you're releasing a new product or a new program on the nonprofit side or the government side, think about your testing very intentionally and making sure that you're getting the stakeholders involved internally as well as externally, so that when you go to market, you have a coalition built that won't let you fail. When you think about UX and CX, design principles from the nonprofit standpoint, I would encourage all of you who are either working in nonprofits now or will work in nonprofits when you graduate as the next generation of leaders, or even as the meso level managers, to present the opportunity to journey map, to map the customer journey to your leadership and to your board. Because I think it really reveals a lot of opportunities for not only improvement internally facing, but how to acquire and retain customers, things that you wouldn't think about, and what moments that matter most along that customer journey are. And then it gives you a great product that you can stick up on the wall and refer to throughout your own journey as a nonprofit executive.
Good advice. John, you want to wrap it up a little bit, and we'll go ahead and let you have back the rest of your afternoon. And
yeah, thank y'all so much for having me.
Last thoughts for us? Yeah.
Yeah, I think that would have been one of my recommendations is think about customer experience, because nonprofits and government agencies exist to serve the people that were designed to help. And so if we put them at the center of everything we do, then you won't fail. So that's kind of my philosophy, so to speak, that I've carried over from running small organization to being a part of a big organization. And please reach out to me if y'all have any other questions too. And I just wish you the best of luck on your own journey as nonprofit and government leaders. And thanks for having me.
thanks for all you're doing. I appreciate you making some time to be able to spend some time with us.
Yeah, thanks for the invite as always.
Our group in there in person, and we ended up with about 45 folks online, so it was nice.
Oh, wow. That's awesome. Well, great to see y'all. Be well, and thanks for having me.
Good to see you too.
All right. Cheers. Thanks, guys.